As a simple rule in medicine, wherever salt goes, water follows. Thus, with an increased level of sodium within the circulation, extra fluid builds up in the body, leading to elevated blood pressure. This is what gave rise to the silly idea that we need to eliminate salt from our diet to reduce our blood pressures. However, with metabolic syndrome, increased levels of a hormone called insulin, induced by high blood sugars, drives signaling at the kidneys that prevents sodium excretion. This means that you don't pee out as much sodium as you normally would if you didn't have metabolic syndrome. As soon as you address the metabolic syndrome and allow for the kidneys to properly excrete sodium and the excess fluid along with it, then the blood pressure can finally normalize. Dr. Unwin, a GP in the UK, was successful in putting diabetes into remission for hundreds of his patients and reducing blood pressure along with it on average by 12 points.
So what you're seeing on this slide is the hemoglobin A1C at the top, but his blood pressure in the one below. So he presented when he was sugary, his blood pressure was 160/95, that's high. And it was 160/95 on the highest dose of an ACE inhibitor. So it was high despite all the drugs I'd given him, he was on the maximum dose. And look, he's come off the ACE inhibitor now and his blood pressure is normal. Again, I hadn't seen that kind of thing in clinical practice. And we find that for people who go low carb, I end up stopping their drugs for high blood pressure. And that's the drugs I got out, but it actually meant, of course, that at the beginning of the study, the patients were on all these drugs. So the blood pressure, and they weren't on those same drugs at the end. So the blood pressure at the beginning was falsely low in a way because they were on drugs they weren't on at the end. There was a variable in there. So I went back on 150 patients and thought, well, what was the blood pressure? Why were they put on how high was it when they were put on the drug in the beginning? And if you do that, the results are even better, where you're getting an adjusted BP lowering of 14.8 against 8.
This shows that hypertension is clearly reversible without medications and responds effectively to this specific intervention not by reducing sodium, but by reducing carbs. So understand, when your doctor tells you to eat less salt, it's not really effective because it's the insulin that's responsible for the increased sodium retention. So in the end, you're just miserably eating really sad, bland food for nothing.